Can one simple morning drink really help protect your heart as you get older? Yes, it can help, and no, I am not talking about an expensive supplement, a trendy cleanse, or some miracle tonic from the internet. I am talking about unsweetened green tea. It sounds almost too simple, to be honest, but simple habits are often the ones that change your health over time, over the long term, especially if you are in your 60s, 70s, or beyond. I am Dr. Charles Oliver, and after years of caring for older adults with high blood pressure, blocked arteries, and failing hearts, I care deeply about practical habits that people can actually keep. So if this kind of honest advice helps you, please subscribe, share the channel, and pass this along to someone you love. One thing I have noticed in clinic is that many seniors already want to do something good for their heart first thing in the morning, but they reach for the wrong drink. They grab a big glass of orange juice, a sweet coffee, a bottled breakfast shake, or one of those so-called wellness drinks that are basically sugar in disguise. What I do myself is much quieter than that. I start with a mug of green tea, not because I think it is magic, but because it gives the blood vessels a gentler environment to work in. Think of your arteries like the lining inside a garden hose. When that lining stays smooth and flexible, blood moves through with less friction. When it gets inflamed, stiff, and irritated, pressure builds. The hose becomes less responsive, and the heart has to work harder to push blood through. Green tea is rich in compounds called catechins, especially EGCG, and these seem to help protect that delicate inner lining we call the endothelium. If that word sounds technical, do not worry. It is simply the body's slick protective coating inside the blood vessels, a bit like the non-stick layer on a good pan. Damage that layer, and things stick, scrape, and stiffen more easily. Support it, and circulation behaves better. And here's the thing. This is not just theory from a lab bench. There was a study published in Heart in 2004 where researchers looked at 20 healthy male smokers in a crossover trial and found that green tea improved endothelial function compared with hot water. That matters because endothelial dysfunction is one of the earliest signs that the vascular system is under strain. Then there was the large Ohsaki study published in JAMA, which followed more than 40,000 Japanese adults aged 40 to 79 and found that green tea consumption was associated with lower cardiovascular mortality, which, if you think about it, is actually quite remarkable for something sitting in a kitchen cupboard. Now, I am not saying a cup of tea can erase a lifetime of smoking, poor sleep, or uncontrolled diabetes. Of course not. But if you want one morning habit that nudges your circulation in the right direction, this is a sensible one. My practical tip is very simple. Brew one mug with actual tea leaves or a plain tea bag, let it steep for 2 to 3 minutes, and drink it without sugar. If your stomach is sensitive, have it after a small breakfast instead of on an empty stomach. Right then, let's go a bit deeper, because the next part is where many hearts get into trouble. When I review blood pressure logs with my patients, I often see the same pattern. Morning numbers are the ones that creep up. That is when stress hormones rise, the body wakes, the arteries tighten a little, and the heart starts the day under more load. So I pay a lot of attention to what people do in that first hour after getting out of bed. Honestly, the body is not that different from turning on an old heating system in winter. If pressure is already high in the pipes and the valves are stiff, you do not want to add more strain than necessary. A lot of you will be wondering, can green tea actually lower blood pressure in a meaningful way? The honest answer is that the evidence is mixed, and I'm not going to overstate the evidence here. Some smaller trials and long-term observational studies suggest a benefit, but not every randomized trial shows a big drop. For example, a study in JAMA Internal Medicine followed 1,507 adults in Taiwan and found that habitual tea drinkers had a lower risk of developing hypertension, with the risk falling substantially among those who drank tea regularly for at least a year. On the other hand, an earlier meta-analysis of randomized trials in JAMA Internal Medicine found tea did not clearly reduce blood pressure overall in short-term studies. That does not cancel everything out. It tells us something important. Green tea is probably better understood as a modest helper, not a blood pressure drug. And that is exactly how I want you to think about it. Not as a replacement for your medication, and not as a test of whether nature beats science. That argument simply wastes time. Think of it more like loosening a few tight screws in a machine that has become a bit stiff with age. You still need the major repairs if they are needed. You still need your tablets if your doctor prescribed them. But a small daily habit that may help the vessels stay calmer while also replacing less helpful drinks can still matter. My tomorrow morning tip here is to use green tea as your first hot drink before the news, before the biscuits, before the second coffee. Then check your blood pressure 30 minutes later if you monitor at home. Do that for 2 weeks and write the numbers down. You know what that does? It turns this from internet advice into your own little real-world experiment. Moving on, there is another reason I like green tea for older hearts, and it may be even more important than the blood pressure conversation. I have a habit in clinic of drawing a little sketch when I explain plaque. Patients laugh, but it works. I draw an artery like a tunnel, then I shade the wall to show how damage builds slowly over years. Not in one dramatic event, quietly. A bit of irritation here, a bit of oxidation there, and then one day the tunnel is narrow enough that symptoms appear. Green tea matters here because heart disease is not only about cholesterol numbers on a blood test, it is also about what happens to those particles after they are floating around in your bloodstream. When LDL particles get oxidized, they become much more troublesome. They are more likely to irritate the vessel wall and feed plaque formation. Green tea polyphenols appear to help reduce oxidative stress, which is basically the chemical wear and tear that happens when the body is exposed to too much metabolic friction. I explain it like this. Imagine leaving a bicycle in the rain for years. Rust does not show up all at once. It accumulates. Oxidation in the body works in a similar way. Slowly, quietly. Then one day, the moving parts do not move so well. There was a recent meta-analysis published in Epidemiology and Health that pooled 38 prospective cohort datasets and nearly 2 million participants. The people with the highest tea intake had a lower risk of cardiovascular mortality than those with the lowest intake, and the pattern suggested that even moderate intake, around 1.5 to 2 cups a day, was associated with benefit. Now, that kind of research cannot prove cause and effect the way a perfect trial would. I always want to be clear about that. But when you combine large population data like that with the biological story we already understand about catechins, endothelial function, and oxidative stress, the picture becomes more convincing. Not perfect. Convincing. My practical tip for this part is to protect the tea itself from becoming unhealthy. Do not load it with sugar, syrups, or creamers. If you turn green tea into dessert, you lose the point. If the taste feels too grassy at first, steep it a little less, or add a slice of lemon. Now here is something that surprised me, and it matters a lot for mornings. And if you are finding this useful, which I hope you are, please do hit the like button, subscribe to the channel, and share this with someone older in your family or circle of friends. It genuinely helps more people see the video, and honestly, that matters to me because the simplest health habits are often the ones people never hear explained properly. Most of the damage I see in diets is not from one huge meal. It comes from repeated little hits. A sweet drink with breakfast, a pastry mid-morning, a flavored yogurt that pretends to be healthy. These things stack up. I tell my patients that breakfast drinks can be deceptive because liquids slide past your appetite signals so easily. You can drink a large amount of sugar before your body even has time to object. There was a large circulation study from the Nurses' Health Study and the Health Professionals' Follow-Up Study showing that higher long-term intake of sugar-sweetened beverages was associated with higher mortality in U.S. adults. Other cohort work in heart linked sweetened beverage intake with higher risk of heart failure in older men. So, when I recommend green tea in the morning, I am not only talking about what green tea adds, I am talking about what it can crowd out. And that is often where the real win is. If your usual breakfast drink is sweet, replacing it with unsweetened green tea is like taking your foot off the accelerator of metabolic strain. Less sugar load, less rapid insulin demand, fewer empty calories. Over months and years, that changes the background noise your heart has to live in. I also get asked what kind of green tea I mean because the options are endless now. Matcha, sencha, bottled green tea, sweet iced tea, powders, extracts, capsules. My answer is boring, and that is why it is useful. I mean ordinary unsweetened brewed green tea. Nothing fancy. Nothing that turns breakfast into a chemistry experiment. In practice, the simplest version is often the safest because you know what you are drinking. Tea leaves, hot water, that is it. There was also a large prospective study in heart using data from the China Kadoorie Biobank with roughly 500,000 adults, and daily tea consumption was associated with a reduced risk of ischemic heart disease. Again, that does not prove your own mug this morning will prevent an event next year, but it does support the idea that regular tea drinking fits into a heart-healthier pattern over time. And when I say regular, I mean regular. Not 3 days of enthusiasm followed by a month of forgetting. Habits protect health when they become ordinary enough that you stop negotiating with yourself about them. Now, some of you may be thinking, what if I already drink coffee in the morning? Fine. Many people tolerate coffee well, and I am not here to start a false war between beverages. But green tea has two advantages for many older adults. It tends to deliver less caffeine per cup, so for people with tremor, anxiety, reflux, or fragile sleep, it can be the gentler choice. Just as importantly, people are less likely to turn it into a dessert. A lot of morning coffees arrive with sugar, syrups, whipped toppings, or a pastry on the side. Green tea usually does not. That matters. If you enjoy coffee and your blood pressure, sleep, and symptoms are stable, I am not telling you to panic. I am saying that if you want one very simple, heart-conscious ritual, green tea is often the easier one to keep clean. My practical advice is this: buy a green tea you do not hate. That sounds obvious, but taste matters. Brew it fresh. Keep it where you will see it in the morning. Use the same mug every day if that helps cue the habit, and link it to something else that protects the heart. Take your medicines, open the curtains, do 5 minutes of stretching, step outside for morning light. Honestly, the body loves routine more than it loves health fads. Now, let me give you the caveat that I think every trustworthy doctor should give. I am not going to sit here and tell you green tea is a magic bullet. It is not. Some of the dramatic claims you see online are well ahead of what the research actually supports. We do not have a giant randomized trial proving that 1 cup every morning will prevent heart attacks in seniors. We do not. Stay with me because this matters. What we do have is a combination of mechanistic evidence, shorter human studies, large observational cohorts, and meta-analyses that point in the same broad direction. That is enough for me to take it seriously, but not enough for me to be theatrical about it. If green tea makes you jittery, gives you reflux, worsens palpitations, or keeps you awake because you drink it too late, then this is not the hill to die on. Use decaffeinated green tea, or simply choose another unsweetened drink that fits your body better. If you take iron tablets, do not wash them down with tea because tea can interfere with iron absorption. If your doctor has put you on fluid restriction because of severe heart failure or kidney disease, then your fluid plan comes first. Good medicine is not about forcing one rule onto everybody. It is about fitting good habits to the person in front of you. In my own routine, I like green tea because it creates a pause, and I think that pause may be more valuable than people realize. When you make a proper mug in the morning, you are less likely to rush straight into stress, news alerts, and mindless snacking. You sip more slowly, you breathe, your morning becomes a little more deliberate. Does that sound soft and vague? Maybe. But habits work by changing context, not just chemistry. I have seen patients succeed, not because one drink transformed their arteries overnight, but because that drink became the anchor for a better morning. Green tea led to a blood pressure check. The blood pressure check led to a walk. The walk led to better glucose control. Better glucose control led to weight loss and more energy, and suddenly the heart is living in a very different body. That is how real prevention usually works. Quietly, step by step, not in fireworks. So if you want the plain answer to the question in this video, here it is. For most seniors, the best simple morning drink for heart protection is unsweetened green tea. Not because it is miraculous, but because it is plausible, practical, inexpensive, and supported by enough real evidence to be worth doing. It may help the blood vessels function better. It may support a healthier inflammatory and oxidative environment. It may replace sweeter drinks that push your heart in the wrong direction. And above all, it is a habit you can actually repeat. That last part matters more than people think. A perfect habit done twice is useless. A modest habit done every morning for years can change the trajectory of health. Tomorrow morning, make 1 cup. Keep it plain. Drink it after breakfast if your stomach prefers that. If you enjoy it, Have another later in the day, just not so late that it disturbs your sleep. Then pair it with one other heart protective action. Take your tablets properly. Go for a 10-minute walk. Check your blood pressure. Eat a real breakfast with protein and fiber. Small things work together, they always have. And to be honest, that is the most hopeful part of cardiology. The heart responds to what you repeatedly do. Thank you for spending this time with me. I really do appreciate it. If this conversation helped you, please like the video, subscribe to the channel, and share it with someone who cares about staying well as they get older. And if you want to go deeper, I have done other videos on simple habits that help with blood pressure, circulation, and healthy aging. So have a look around the channel and keep learning consistently. Take care of yourself, and I will see you in the next one.